All right, y'all, let's dig into some real-world injuries that we see not just in the hospital, but on the playing field and at work. These are the kinds of injuries that come from movement, repetition, strain, and sometimes just plain bad luck. Sports-related musculoskeletal injuries. Now, sports injuries are everywhere. Sprains, strains, dislocations, fractures. Athletes of all ages deal with these. They're usually caused by overuse, poor technique, not warming up, or sometimes just a direct hit. When an athlete comes in, the first thing we look at is mechanism of injury. Did they fall? Was there a twist, a blow, or overexertion? Then we go straight into assessment. Pain, swelling, deformity, loss of motion. That helps us know if it's a sprain, strain, fracture, or something more serious. Management follows the basics you probably know. RICE, rest, ice, compression, elevation, along with pain control and immobilization if needed. The athlete's mindset is key here. Most of them are highly motivated to get back to play as quickly as possible, which is great, but it also means we have to reinforce activity restrictions. If they rush it, re-injury is almost guaranteed. Recovery times vary, sometimes just a few days, sometimes 12 weeks or more, depending on the severity. And the big rule? No return to play until they're pain-free with full range of motion. And here's the good news. Most sports-related injuries are preventable. Proper equipment, correct training, hydration, stretching, and nutrition make a huge difference. Prevention really is the best treatment here. Occupation-related musculoskeletal disorders. Now let's switch gears to the workplace. Occupational musculoskeletal disorders, sometimes called ergonomic injuries, are caused by repetitive stress, awkward positioning, lifting, pushing, pulling, and just plain wear and tear on the body. According to the Department of Labor, the most common causes are sprains, strains, and tears. After that, soreness and pain are big contributors, and then we see fractures, cuts, and bruises from workplace accidents. These injuries can sideline workers for days or even weeks. Occupation-related musculoskeletal disorders in nursing personnel. And let's not forget about us, nurses. Nursing is consistently ranked in the top 10 occupations for work-related injuries. We are at a high risk for musculoskeletal disorders because of heavy workloads, unsafe patient handling, and long hours on our feet. Think about it. Lifting patients, turning patients, pulling them up in bed, bending and twisting to reach equipment. All of that adds up. The result? Back pain, shoulder strains, repetitive motion injuries, and sometimes permanent damage. Professional groups like the American Nurses Association, ANA, and the National Association of Orthopedic Nurses, NAON, have been pushing for years to adopt safe patient handling programs. That means using lifts, transfer devices, and team techniques instead of relying on brute force. Evidence shows these programs reduce injuries and lost workdays. For us as nurses, prevention is everything. Good body mechanics, asking for help, using available equipment, and speaking up when assignments are unsafe all matter. At the organizational level, leaders must commit to safe handling policies, not just leave it on the shoulders of staff. Take-home points. 1. Sports injuries. Usually preventable, but when they happen, management is focused on RICE, pain control, and no return to play until pain-free with full ROM. 2. Workplace injuries. Most common are sprains, strains, and repetitive stress problems. These are costly in terms of lost time and long-term health. 3. Nursing injuries. Nurses are at especially high risk. Safe patient handling programs and good ergonomics are essential to protect the workforce. At the end of the day, whether it's an athlete on the field or a nurse on the unit, musculoskeletal injuries affect performance, safety, and quality of life. Our role as nurses is to treat, educate, and advocate, both for healing and for prevention.